Welcome to the first week of ethics. This is one of those courses that you may be questioning, why is it that we even need this? Brady, shouldn't this be just something that we really look at and trust ourselves in the good people that are doing the work, that we really don't need this? And it would be great if we could operate from that standpoint, but if we sit there and think it gives us accountability. Accountability from the standpoint of the kingdom of God is a good thing. And because of that, we have parameters, we have ethics, the guide rails to ensure that we are practicing expressing who we are as children of God in the seat of a clinician, expressing and operating in the way that Christ would have us. And so today we're going to start with what might seem as the least exciting chapter of the whole course, the whole book, an introduction. But I want to convince you for the next 45 minutes or so that it might be one of the most important. And throughout the semester, we're going to constantly come back to this. This is one of the reasons why I wanted this to be a video message. And of course, I will be recording the video lectures that we have when we meet collectively. But this is one that I want you to be able to refer back to. And so being able to articulate it with the formation of without any perspective as we lay that foundation. So everything else that we're going to be covering this semester: informed consent, confidentiality, multiple relationships, working with minors, technology, telehealth, cultural considerations, risk management, and on and on and on, will really be built upon these foundations. And really, to kind of kick us off, we're going to be looking at 4. But if we don't have a clear sense of what ethics actually are, how they're different from law, how it's different from actually being nice, a competent individual, then the rest of the semester will feel like a list of rules that I am asking you to memorize, instead of actually a way of thinking. And that's really what I want you to get through this course, is not hearing it as a list of do's and don'ts, but hearing it as a heartbeat. How do I hear the heartbeat? How do I listen for the heartbeat? And how do I operate within the heartbeat? Well, Brady, great. What does that mean? The idea that through the foundations of, regardless of where you find yourself in the field of academia, whether this is your first course in the graduate student, the graduate side of things, whether this is your last, whether you're somewhere in the middle, that the fluidity of ethics will continually to shift. I like to articulate, it's like nailing jello to the wall. Now, of course, there is a foundation, so it's really not a fair illustration, but it's almost to that extent. In 20 years of practice, in the church, out of the church, as an LPC, I have seen things change so often, and rightfully so. We have a great board. We are operational underneath the BHEC, the Behavioral Health Executive Council, and they do a phenomenal job, along with the American Association of Marriage and Family Therapy. How those are differing depending upon what test you take, how you want to operate, and who it is that you're called to impact. So my promise for you today is, hopefully by the end of this lecture, that you should be able to do 4 things. Is being able to define things that really create the foundation, such as ethics, and distinguish them clearly from law, morality, and professionalism. Because most students always blur these concepts, and when we don't have a proper understanding of what definitions are, what they mean and what they don't mean, then it becomes very easy to blur them. I had a mentor early on in my time as in the church, when I was actually coming in, working on my hours as an LPC, who would articulate that one of the first and one of the first areas of bondage that we can fall into is the bondage of our definitions. So it is imperative that we have a good understanding of what these are. Second, we want to be able to explain why counseling profession needs a formal code of ethics in the first place, rather than just trusting individuals to do the right thing. it'd be great to be able to trust, but what we find time and time again is counselors can, not that they always do, can uh, express themselves in unethical ways. So the more that we have a good understanding of that heartbeat that I was talking about earlier, what it is, why it's there, and keeping up with the updated rules and mandates, then as a result of that, that we will ensure that we're doing things the right way. What is the right way? That we are operating very ethically. So, third, we want to be able to describe the difference between mandatory ethics and aspirational ethics and explain why the distinction matters for how you practice. As well as fourth, we want to walk through at a beginner level how principal ethics and virtual ethics offer two different lenses for making ethical decisions and having that foundation so that as we get going, we understand that when we come to a fork in the road and not knowing should we turn to the right or to the left, that we have a premise to be able to lean on that can give us an understanding to put our client in the best opportunity for growth, for processing, for hope, and knowing that we're doing that from some premise. So I want to start with a question that I want you to sit with rather than just go ahead and answer. So sit with it and then permeate that within yourself to the point of answering this. Why do counselors need a separate course on ethics? Why do counselors need a separate course on ethics? And what you're going to find as you pause or as you're keeping this going and you're thinking about this, all throughout the formation as a counselor, there are going to be time and time again that you're going to get to review the ethics. For the LPC side of things, we get every 2 years CEUs that we have to adhere to, and ethics is a part of those. We have to take so many ethical classes to ensure that we know the rules, operate by the rules to ensure the greatest success and expressions for us as being people that are in a field of help. So as we think about the very question I asked, you don't see required ethics of accounting course with the quite same of intensity, or at least one that determines whether or not you can practice at all. Different professions operate under different bylaws, different ethics, different boards. And so in that is when we look at other professions, they operate differently. I've, in 20 years, have had the opportunity of working near psychologists, psychiatrists, nurse practitioners, chiropractors, massage therapists, and they are all beneficial, at least from my perspective. And getting to see how they operate is fascinating. Things that are no-nos to us, they can operate and express themselves in those formations. And so if we have friends, if we have loved ones that are in a helping profession underneath a different board, then to operate in a similar fashion can actually do something to get us in trouble. So what's the difference about counseling? I'd argue that there are three things that make our field usually dependent upon ethical practice. First, the power differential. You see, when someone sits across from you in a counseling relationship, they are oftentimes at their most vulnerable state. They're disclosing things that maybe they've never said aloud, trauma, shame, despair, grief, and you as a counselor hold knowledge, credentials, and the kind of authority in that room that your client just does not have. And understanding that power differential, how do we operate accordingly that we don't actually use that power differential to manipulate? You see, that imbalance creates real risk of harm if it's misused and even if it is unintentional. And so we need to be aware of the power that we operate in the room and to ensure that we are not displaying that in a way that actually creates manipulation, that creates a formation that can actually impact our client. Second, the invisibility of the work. Unlike a surgeon whose mistakes are often visible on an x-ray, a counselor's harm can be, not always, but a lot of times it can be invisible, even to the client themselves, not only in that moment, but weeks, months, and years even thereafter. A boundary violation, a poorly handled disclosure of suicidal ideation, a failure to understand a client's cultural context, these are things that can do damage that may not necessarily show up as a scar. So you're not going to see them, the client may not see them, but over time they will feel the impact. That invisibility means that the profession has to build safeguards proactively rather than waiting on the obvious harm to appear. And so by doing that, what we find is the power differential, the idea of the invisibility of the work that we do, as well as the ambiguity of the work itself. You see, medicine, for all its complexity, has protocols. If the patient presents the doctor with X, they do Y. Counseling is very rarely that clean. It'd be nice if it was, and sometimes it actually is, but more times of what I've seen than not is it really is very nuanced. Two competent ethical counselors can look at the exact same client situation and choose two different modalities, two different expressions, two different ways of course of actions, and both defensible. That ambiguity means counselors need more rules. They need a way of reasoning through those situations where the right answer isn't obvious, right? Where we see the need of a way of reasoning through situations where the right answer isn't always obvious. So if the right answer isn't always obvious, then what level of parameters do we place ourselves in to ensure that we are doing no harm, which we'll talk a little bit about here later on. So if in medicine, like we were talking about, if they come give X, then the obvious answer is Y. But with that, in counseling, that is not the case. You can have an individual, and I know I talked about 2 counselors, you can have 100 counselors look at the same individual, same case study, and they may pick 100 different modalities to go from. Some may look at it solution focused, some may look at it from cognitive behavioral, psychodynamic, and again, nothing wrong with that, Brady. Okay, absolutely. How do we express that in a way? If there isn't an obvious right answer, then how do we keep ourselves in a parameter that is going to do no harm? So when we study ethics in this course, we're not just memorizing a rule book, and please hear that. Now, again, if you want to memorize the rule book, by all means, please do. But really, as you're going to constantly hear the heartbeat, feel the heartbeat, operate within the heartbeat. And as we do that, it all comes back to how we cover our client. If we make our priority to align ourselves with Christ and to cover our client, then we, in almost the vast majority, I don't want to say 100% of the time, but almost to the extent of 100% of the time, we will be operational ethically. Now, if we make it about ourselves, now because of that, we're actually pulling the covering off of our client to make sure that we're covered. And by doing that, we're uncovering our client. When we do that, that puts us in a greater opportunity to create an ethical gap. So again, please hear that. We're not just memorizing a rule book. We are seeing the formation, a set of lenses to operate from, that as a result, as we understand our professional identity, we are carrying a way of thinking that you can establish for the rest of your career. By sitting there, somebody coming up as a peer, hey, Brady, did you just hear about the new rule change? No, what is it? And then you hear about it and you're like, oh, okay, yeah. I already kind of operate, actually I do operate from that formation already. Why? You already knew about it? No, but because the basics are the basics. The heartbeat. Feel it, hear it, operate in it. Make sure you are covering your client. It's a premise that I go by, and I feel like it has done wonders for me. I may not know 100% all the rules all the time. I tried to make sure that I'm astute and I'm putting attention and focus on that. But as new ones come up, if I miss it for whatever reason, if I make everything about my client and covering them, then that puts me in a posture where good things can happen. Okay, so let's see. So we're going to move into defining our terms. One of the most common mistakes I see students in their expression and in their writing is the understanding of what is ethical, what is legal, what is moral, and what is professional. And from the standpoint of not having a good definition, and because of that, it becomes very interchangeable from their perspective. And as these four words, and utilizing these four words as being the same thing, but they are not. They have different premises, and we want to take a look at each one of them. The first one we're going to actually start with is morality, which actually refers to a person's individual beliefs about what is right and what is wrong. And so as you go through this class, I want you to evaluate what your morality is. Okay, please hear that. That is your decision as you evaluate that with Christ. Okay, it's deeply personal, often shaped by family, origin, culture, as well as life experiences. Your morality is yours, even though it may not be written down, as it's not in a code that governs your license. It's something that is necessary and needed for us to be aware of. And I want you to give yourself some time this week to sit there and say, what is my morality? What do I consider right? What do I consider wrong? Because again, the more that we have a good understanding of that, then to the extent of how do we express that to determine what is ethical and maybe what is unethical. Two counselors can have different moral views on, let's say, ethics of divorce or premarital relationships. Both can still have excellent ethical components as well as being ethical counselors, as long as they don't impose their personal views on their client. And that's something that, as we are aware of, the more that we're aware of, you're going to hear in the classes that I teach awareness, 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 awareness. Awareness, awareness. Okay, I get it, Brady. The more that we're aware, the more that we can own. Not from a place of identity, but from a place of this is where I am. When we acknowledge more where we are, then we can have a greater sense of where we're called to be. It's like going to the Mall of America. Where is the Foot Locker? And I use it as an illustration actually in the book. So as you go through the book simultaneously of the book on ethics, you'll get to see that illustration. So the idea of that is, how do I become further aware of what my morality is? And then ethics, how do I make sure that I don't project them on anybody? Okay. Ethics, by contrast, refers to standards of conduct that are generally agreed upon by a group. In our case, by the counseling profession as a whole. Ethics in this professional sense is coded, written down. It's within the American Counseling Association Code of Ethics, or the codes published by the ACA divisions or by the NBCC. Okay. By state licensing boards of conduct. Ethics, in sense, is not about your personal values. It's about what the profession as a collective body has decided is acceptable and unacceptable practice. So the idea of that is, you may sit there and say, I don't personally believe, my morality is I don't agree with the ethics of the board that I am sitting under. Well, here's the thing. They don't care, okay? And I don't mean that to be insensitive. We need to be aware of the ethics, what the state licensure is asking of us, so we can be operational, okay? To have authority, we need to be under authority. And so in that, how do we submit ourselves unto Christ and unto the law of the land if we, one, don't understand our morality, and understand, two, the ethics of knowing how to express it, and the things to making sure that I don't indoctrinate, okay? Now, this distinction matters enormous. You can act in a way that violates your own personal morality, but it is perfectly ethical under the professional code. For example, referring a client to another provider for a service you're not personally comfortable with is actually very ethical. You can, in theory, act in a way that feels morally justified, but it can be a tremendous ethical boundary violation. I believe it's harmless to become friends with a former client on social media the week after termination when the code says otherwise. And so this is where I've seen counselors get themselves into trouble, where they can justify. Well, Brady, there is such a connection with this individual, and because of that, here's what I feel like they need. They need, or you need. So morality, ethics, law is third, which is a separate category. Laws are rules created by governing bodies, state legislatures, Congress, regulated boards. that carry the force for legal consequences. Civil liability, criminal charges, or license actions. Law and ethics overlap substantially, and typically what is considered unethical in most parts is considered illegal as well. But they aren't always that way, but a good rule of thumb is actually seeing them that way. Imagine a counselor who is technically competent but consistently rude, dismissive, or abruptly demeaning towards a client from a particular background. Now, being people of belief, I know that that would never be any of us here because we would be violating who Christ is to us and his expression. Now, that might violate your ethical obligation to respect client dignity without technically breaking any law, but there are things that might be legal in a given jurisdiction but still ethically fraudulent. And so we need to be aware of what are ethics, what are legalities. I want you to consider this. Consider a counselor operating in a state with very permissible rules about dual relationships in small rural communities. Which again, even as I articulate this, it's hard to continue to move forward because from our standpoint, there aren't any. The idea of dual relationships, for the very reason of creating objectivity, is a necessity. Let's continue on though. The law might allow something the ethical code would still ask you to think very carefully about. And I've seen how some counselors can blur the lines on what dual relationships are. Dual relationships, as you look them up, counselors have and continue to get themselves into trouble, especially counselors that take referrals in from churches. Nothing wrong with that. I actually do that, but it's not about if you do, but how do you do it in a way that is ethical. A lot of individuals do it from the place of where they go to church. Again, nothing wrong with that, but how do you do it in a way? If you are in a small group and you know everybody there and you're a part of that and people are referring to you from the standpoint of the church's standpoint, well, Brady, people like to go to people where there is equity. They're completely understandable. Being a pastor on multiple staffs, I get that. With that being said is, and our morality may say there's nothing wrong with that. Ethics actually says something different depending upon what degree. Again, that could be the caveat of dual relationships of, now, but if you're a part of a small group and there's a consistency, then as a result of that, the board, at least BHEC, would frown upon the idea of you counseling those individuals because they come back and actually ask, what level of objectivity do you have? And what you'll find time and time again is objectivity is one of those ethical boundaries that our board instills to ensure that you are giving the greatest counsel and opportunity for success for your clients. And finally, so we have, let's see, morality, we have ethics, we have law, now we have professionalism. And this is probably the broadest of the four terms, of course. It encompasses the behaviors and the attitudes and the standards that define what it means to conduct yourself as a member of a respected profession, such as punctuality, appropriate dress, sound business practice, lifelong learning, which again, being a professional, you get to do, or you won't be able to renew your license. So that's just something that you get to do if you want to be a part of a licensed entity. Okay. Self-care that keeps you fit to the practice. And what we find time and time again, and this is going to be a subject of thought, but you'll find individuals that will become certified in whatever it may be. But if they're not practicing, how are they staying fit within their profession? So that is something that we need to be cognizant of as you operate, because there can be, and there's no disrespect, but supervisors who have practiced for a long, long time, or maybe not, but they practice long enough to become a supervisor, and then stop seeing individuals, but yet are still supervising. Okay, again, what are your thoughts about that? Because that could be something that could actually be a part of professionalism. Some people believe it be okay. Some people believe, guess what? No, that's one of those gray areas that I ask, you get to decide because it's going to be you that actually sits in that seat. Let's see. Professionalism includes ethics and often overlaps with law, but it includes things that aren't formally coded anywhere. Okay, how you communicate with a colleague that you disagree with, or how you handle billing disputes with tact. How do you operate with interacting with individuals that you may not specialize in? How do you, regardless if they're your client or not, how do you show them dignity? How do you validate them in their personhood? Because that's where professionalism is foundational, but even for us being people of belief, that there is a greater call of reflecting the goodness and kindness of Christ in everything that we do, especially for us being people that are of professionals. Okay, so a way to kind of hold these four complexities is morality is personal, ethics is professional and coded, law is governmental and enforceable through courts and licensing boards, and professionalism is the broad umbrella that contains it all, plus the everyday conduct that makes someone good to work with and trustworthy to the public. You want to be trustworthy and good to the public, then have a tremendous professionalism about yourself. Okay? Have a tremendous professionalism about yourself. Okay. And we're going to talk about these four complexities all throughout the semester, and we're going to go back to them. So it's good for you to understand what is the definition, but what is a working definition for me? How do you take these definitions, elevate them to Christ, and say, God, give me them in my own words so that I have them as a walking understanding universally, that I can actually articulate them and operate from them at any point in time. So, where do ethical codes come from, and why do we need them? Professional codes of ethics are not handed down from high. They are living documents written from periodically revised by committees and professional organizations. For counselors, primarily the American Counseling Association, through specialty organizations like things like American School Counselor Association, as well as the Association for Multicultural Counseling and Development, to maintain codes tailored to their specific practice within their context. Some of you may want a additive licensure, something of working with sexual offenders, play therapy. These more specialized licensures that actually have their own board to orient to, that we need to be aware of. Now, again, in that, like I have a counselor in the suite next to me that does that. She is a licensed professional counselor, of course, but then she has felt the calling of impacting people of sexual offenses, which I'm grateful for people and their callings, because again, we're all called to something different. When I got to meet with the lady, she is remarkable. So in that, she has an additional licensure to actually adhere to. And so in that, we need to be aware of that. Her additional licensure doesn't trump that she doesn't have to adhere to the BHEC and everything that the LPC asks the rest of us to do. She has to adhere to that, but as well as her licensure as a sexual offender treatment provider. So now these codes serve several distinct functions, and I want to talk through each one of them. Not that you're going to be tested on them, even though you will be. Well, Brady, you just kind of contradicted yourself. Even though you won't be tested on them, even though you will be. Okay, so there's a good chance anything that is in the book is fair game on the test. Now, with that, there are going to be opportunities that we actually review questions on the test, because again, this is not a class that I want you to stub your toe on. This is not a class that I want you to keep you from moving forward. Well, I don't want to do that in any class, and neither does any other professor in this institution. We want the best for you. We want you to succeed. We want you to get a 4-point. We want you to be pass the test on your first time. We want you to be successful in the field. And there are so many different opportunities that we create for those very milestones. So in that, a lot of what we're talking about is for you. A lot of what comes across on test, main concepts of what we're talking about, a lot of from the book. Okay, so here. The first functioning is protecting the public. This is arguably the primary purpose. Codes exist to protect consumers of counseling service from harm, whether intentional, whether unintentional, by establishing minimum standards of acceptable conduct. And by doing that, and our focus being on the client, being on the public, that gives us a way to be able to cover them. The second function is providing guidance for practitioners to ensure accountability for us. A code gives counselors, especially those early, but yet just because we may be early in the nuance of counseling doesn't mean that as we continue to become more seasoned that we can just throw caution to the wind. No, we still operate by the same formations of the ethics that everybody else does. But they give us the framework for navigating situations that maybe we've never encountered before. When you're sitting with a client and something feels off, but you can't quite name it, you can't quite formulate a theoretical framework to know how to maneuver, a internalized ethical code gives you the language and structure to actually work from. It gives you something to say, I can sink my teeth into that and I can at least push the boat out in the ocean and get a better feel by having a code to actually work from. Third function is to enhance the professional's ability as well as credibility. When a profession self-regulates through a clear enforceable code, it builds public trust and often reduces the need for heavier external government regulation. The idea of knowing how many people come to counseling because they know it's bound by confidentiality. Absolutely. With that being said, though, we need to understand the limits of confidentiality as well. But it brings a safety and a comfort that I have seen during my time in the field, that people come in that they could go talk to anybody, but they come into counseling because of some of the rules and regulations that we get to abide by. Okay, in a sense, codes are ethical. Codes are ethics are somewhat self-interested. A strong code protects the reputation of counseling as a discipline. And guess what? You get to play a part in that. We all do. Each and every counselor gets the opportunity to pour in to the field who they are. And what we don't want is to take from the field and not give back to it. And so where people are sitting there saying, man, I had a bad experience as a counselor. When I hear that, my heart is, hey, how do I give them a good experience? How do I give them a good experience? By practicing the ethics, by being professional, and by covering them and pouring out who I am as a child of God. Now, the way that that's expressed may look a little bit differently, but in that, if I do that, I feel like I can look at myself in the mirror and I am doing the best I can to give them a good experience. The fourth function is serving as a basis for accountability. Again, accountability is a good thing. Accountability is all throughout Scripture. Having people that we can submit to, account for. When a complaint is filed against a counselor with a licensing board, with an employer, or in a lawsuit, that code becomes the yardstick against which the counselor conduct is measured. Hey, did the counselor adhere to best practices or not? It is the document courts and boards that will refer back to when deciding whether harm occurred and whether it was foreseeable or not. And the idea of that is, how do I ensure that I'm being accountable to the board, to God, to my clients, that I am expressing who I am as a clinician to the best of my ability for the greater good of the individual. Now, it's worth pausing here to acknowledge something important, okay? Codes of ethics are not perfect. They are guardrails. But they aren't perfect. They are timeless documents. They are shaped by the historical moments in which they're written, as well as they are changed, okay? And they do change quite frequently as our boards are looking for a more cohesive, stabilized way of expressing And as new things come up, as new boundary violations or gaps are established, then they need to go back and look to determine what's going to be best for not only the individual that is associated with that violation or gap, but every counselor that is associated with the board. Excuse me. Earlier versions of counseling codes, for example, said a little bit about technology, about teletherapy, as well as social media. 20 years ago, we weren't talking about these things. We weren't talking about social media. We weren't talking about teletherapy. We weren't talking about technology. I remember when my supervisor came and he was looking into practicing and contracting with a gargantuan online company, telehealth company. And we were having lunch one day. He's like, Brady, what do you think of telehealth? And I remember thinking, it's the biggest joke. It will never take off. Yeah. $1 billion industry. Okay. So in that, we see the benefit of using technology and teletherapy, even social media, but how do you do it? How do you do it? And a lot of times we hear yes and no. And a bigger question may not be yes or no, but it may be how. How do we do it? Because really that's where a lot of times we hear yes and no from based upon the way it's expressed. Codes have also evolved substantially around issues of multiple competence, LGBTQ, affirming practice, social justice, advocacy, as well as reflecting the profession's growing understanding of these areas over time. So how do you operate? Whether you are called, what are the ethics? What are the ethics? Can you specialize? Can you turn away? Can you refer out? How does that work? And we are going to get into all that throughout this semester as we look at our morality, as we look at our ethics, as we look at the law, as we look at professionalism to determine what does that look like for each and every one of you that's actually in this class. Understanding that codes evolve should make you more thoughtful readers of them, not less committed to them, okay? And that is important. Well, why put emphasis on it if it's only going to change anyways? The change is additives or slight tweaks or change to the rules and regulations. And the more that we have an understanding, the more that we are going to understand the nuances of the changes. If we have no understanding of what they are to begin with, then as a result, as new rules and regulations are passed down, it's going to be extremely difficult for us to maybe wrap our mind around it. So, mandatory ethics versus aspirational ethics. Okay, now this next distinction, as we talk about, is one of the most practical, useful things that maybe you'll learn throughout the semester. Okay, so I want to slow down here and make sure that we don't go too fast. Now, these are two levels of ethical functioning. One is mandatory ethics, which actually refers to the floor, the minimal level of professional behavior, basically that you can express to keep your license and stay out of serious trouble. Now, from that, we need to understand what the floor is so that we can build upon that. Now, if we want to know the floor just so that we can say, hey, if I can know the floor and operate by the floor and I operate by mandatory ethics, then guess what? I will not get myself in trouble. And what I will say is, yes, but is that the best way of looking at it? Being people of belief in Christ, we are called to express His goodness. Did He only operate by status quo, or did He go above and beyond? Well, Brady, He's Jesus. He always, okay? So in that, we're going to get to the place of looking at aspirational ethics. In order for us to express ourselves from aspirational ethics, we need to first understand the floor of mandatory ethics, okay? So this is the compliance level of thinking. What do I have to do to avoid a complaint, a lawsuit, or a loss of license? Now, nobody should practice below this floor. And really, this type of mindset is eventually going to get the individual in trouble. Why? Because if this is the floor, it's a matter of time before the floor becomes a little gray and to the point that they are now operating in ethical gaps and ethical dilemmas. Okay. But if mandatory ethics is the only level at which we are able to operate, we are going to be mediocre, minimally adequate counselor, technically compliant, but not particularly good to our clients. We are only offering them the bare minimum. And so in that, if you're looking at private practice, or let's say you're working for a clinic, the idea of that is how long are you going to be able to maintain your job? Probably not very long. And if you have a private practice or you operate in private practice, your clients are going to want to go to somebody else. So now we get into aspirational ethics that really is a great way to operate. So it refers to the highest standard of conduct as a counselor can strive for, not the minimum required to avoid punishment, but the fullness of expression of what it means to act in the client's best interest. And there it is. How do I make sure that what I'm doing and how I express myself is in the client's best interest? So aspirational ethics asks not what am I required to do, but what is the best, most caring, most clinically appropriate sound thing that I could do here, given the situation of what I know about the client and what they're going through. And by having that type of mindset, we put ourselves in a position where we can impact the client. We are covering them, and we are operating in a way that is going to be beneficial to the client. So here is an example to make this concrete. Imagine if a client discloses a fairly offhanded way that they have been having thoughts of self-harm, but insist that they're fine and don't want to talk about it further. Mandatory ethics might require you to conduct a basic risk assessment and document it. Some mandatory ethics may sit there and say, well, wait a second, I'm going to document it, that there was suicidal ideation, but the client's own verbiage that there was not a plan and actually articulated that he was fine. I will continue to assess, but in that, don't need to determine any further actions because he said or she said that she is fine. And if I ask the question to go further to ensure the best for the client, guess what? It might open up a can that am I really wanting to open? Aspirational ethics would push you to think more broadly. How do I create enough safety within this relationship that the client feels comfortable bringing this up? And so the idea of mandatory is, oh my goodness, I don't want to extend myself because if I do, what if I have to actually call and make sure that they go and turn themselves into a hospital? That's a lot of work. I don't want to have to do that. And the thought process actually gets placed upon me as the clinician and not the best for the client. Am I attending not just to the words, but to the tone, to the body language, to the patterns over multiple sessions? Am I considering this client-specific cultural context around discussing mental health? You see, mandatory ethics get you through the legal and licensing risk. I would actually articulate, yes, it does, but it puts you closer on to create a gap. Aspirational ethics is what actually makes you good at being a clinician. And the great thing about being at this institution, what I've seen time and time again working with the students here is that they want to be the best. They want to be the best. And those are that's one of the greatest things that I get to do as a professor. I get to see what's coming down from the standpoint of what's coming, well, I get a better way of saying that, it's coming up in the profession of counselors. And I am excited. I'm excited. How do we continue to create excitement in the field? Continue to make sure we're operating not from mandatory ethics, but aspirational ethics by doing what? First, understanding the mandatory ethics. So I'd encourage you as you move through your training and as you move through your class, and not only this class, but other classes, is which of these two frames do you default to when you imagine yourself as a counselor? Start there. Awareness, assessment and awareness. And if it is mandatory ethics, which again, I will say transparently and vulnerably, I have been there. How do I make sure I don't get myself in trouble? And you know what? We can move by through honoring the assessment and the process to eventually get to aspirational ethics. If your gut instinct is, how do I stay out of trouble? That's normal starting part, especially early on in training when the stakes of the mistakes feel very high. And that's why early on in practicum, you'll have a practicum coordinator here at the Kings, and she is amazing. But not only that, but you'll have a supervisor in whatever clinic that you get to count hours through. And then after that, after you graduate, you take your test, you will go get a supervisor. That supervisor, whether it's off-site or not, you're going to have an on-site supervisor, but you're going to have a supervisor attached to your license counting your hours to ensure that, guess what you're doing is making sure you are aware of mandatory ethics, as well as aspirational ethics. And again, we want you to be able to practice 20, 30, 40 years in this field. And part of that is making sure that we don't get burnt out through the fear of making sure that we're going to do something that's going to get ourselves into trouble. So the two ways of thinking about ethical decisions. We got principle ethics and virtual ethics. So you don't need a philosophical background to understand these. We'll keep it very practical. I think the book does a phenomenal job of going in this. Principle ethics ask, what should I do in this situation? Real solution focused, if you think about it. What should I do in this situation? It is action focused, rule and obligation based way of reasoning. Under this framework, ethical behavior is guided by a set of core principles. So in counseling, these are commonly grouped into several categories. First is to respect the client's right to self-determination, okay? To make their own choices about life, even choices that you may not like yourself. And so in that, the idea is going back to what you believe about right and wrong, and the idea of not interjecting that onto the other individual. And this may determine a lot about how you specialize. What populations do you specialize? And how you go about that. Do I work with individuals? Do I work with multiple individuals? Marriages, families? Do I work with teens and next generation, kids? Or do I not? So the idea of that is, how do we validate people, not agree? Again, validation can be agreement, but validation is recognition. I see, I hear, I understand. What speaks to acceptance? Acceptance speaks to love. And when we can do that, then regardless of the decisions that they're making, can we validate them and their personhood? Not what they're choosing, not what they're contemplating, but the idea of that, so that they can actually lean into the process and we can help them understand. So if they are in a place of making a decision that we don't like, it's not that we're driving that, we're trying to change their mind, but that we have an understanding their best interest. And so if it's, let's say, a divorce, okay? Now, are there certain parameters? Okay, as scripture aligns, but what does it look like if, from the standpoint, it's just irreconcilable differences, Brady, nothing harm, no foul. I'm tired of him. Okay, so what I would do, and I think one of the things that you can get really good at in the process as you're learning to impact people is get good at asking questions. This is one of the skills that will impact your practice and how you impact people from generations. Get good at asking questions. Okay, so if you choose to leave him, that gives you what? I don't know. Oh, okay. Okay. So it sounds to me like you're making a decision. Is that decision based upon love, or is that decision based upon pain? Well, I really didn't like what he did. Oh, okay. And so in that, I'm having to push aside my morality, what I believe is right and wrong, for the greater good of the individual. But with that, the extent of, do I believe what's best for that individual? And how do I make sure I don't indoctrinate them, but that I let it drive me to what I think is best for civilization, for people to stay together, my personal opinion. And with that, how do I interject it in a way that is not indoctrinational, because that would be unethical, but in a way that gets them, the client, to contemplate so that they're ready to determine what it is that they want. The next is the obligation to avoid causing harm. This is often considered the most foundational principle at minimum, to do no harm. And that's exactly our heart. We want to make sure that when they come in, what is the one thing you want to give them, and what is the one thing that you want them to walk out with? I want to validate them. Validate, 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 validate. Not validate what they're contemplating, not validate what they're going to do, but validate them in their personhood. And I want them to leave with hope. And if I can do that each and every session, then I consider extreme success. Third, actively promoting the client's well-being, going beyond simple avoiding harm to doing positively good. And that's how I personally affirm that. Now, how would you? How would you do that? Next, treating clients fairly and ensuring equitable access to and the quality of services regardless of background. We want to make sure that we are impacting people in the way that Christ has called us to. And by doing that, we can ensure this, that we are not withholding or leaning into another group of individuals. Now, if we specialize, then the group that falls within that specialty, that's who we're leaning into to create impact, positively, of course. And then we want to honor commitments and trust, doing what you'll say you'll do, and being loyal to the counseling relationship, which really speaks back to professionalism. If you can't do it, don't say you can. Be who you are called to be by honoring what you say you'll do. And then last, dealing honestly with clients. I know a lot of times it may be difficult early on in the novice nature of being a counselor, of delivering hard truth. How do we do it in a very honoring, loving way? Can't work with an individual, whatever it may be. How do you articulate that in a way that is affirming and impacting? Okay. When you use principle ethics to work through a dilemma, you're essentially asking which of these principles are in play. And this can be the hardest part, because what to do when two of them conflict, okay? So the idea of this does happen. What happens when you're sitting there and you're operating off of one, and then you have another, and those two are actually in conflict, because they often can. Such as respecting a teenager's autonomy might conflict with your obligation of impacting impacting their obligation to avoiding to do no harm, right? The idea of what the teenager is really asking in that moment, but what they're asking is actually something that you believe is going to cause harm. And those two are actually in conflict. How do you respect the teenager that is engaging in what we would genuinely consider dangerous behavior? Much of ethical decision making in practice, is exactly this: weighing the competing principles against each other in a specific, real situation, rather than mechanically applying in a single rule. Okay, so the idea goes back to, who are we as clinicians? How do we operate? What is it that you want to give? The associates I work with, people that are actually working on their hours, they've already passed their test. I want to simplify the process for them. And in that, I constantly ask, what is it that you want to give them? What is it that you want to give them? What is it that you want to give them? What is it that you want to give them? And in that, the idea is, if we can sit there and fundamentally believe, then that can guide a lot of the principles. Well, I want to give them hope. Okay, so an individual, a teenager that is operating in some dangerous behavior, and to the extent I want to make sure I do no harm, then as a result of that, if I affirm her behavior, could that really, am I going against, one, this principle, and two, who I am? I want to give hope. And how do we do that? Hey, so the things that you're doing, do you feel like that they're safe? Yeah, Brady, I do. Okay. And when you're able to operate from them, now again, working with a teenager may be a little bit differently because of just the dynamics of chronology, just their age. But if I was operating this kind of component with an adult, because that's kind of here lately what I've been doing, what is it that you're trying to give yourself? What is it that you get from operating in that complexity? I don't know. Trying to reverse engineer it to the ground level to help them understand the need base that this is attempting to meet and determine, is that legitimate or illegitimate? Okay. Virtual ethics. Ask a different question. Instead of what should I do, it asks what kind of person, what kind of counselor should I be? You see, this framework is less about following the rules in the moment and more about cultivating the underlying character traits that make a good ethical judgment likely in the first place. So you hear the difference. One is expression, one is about identity. And can you be operational in both? I think the dynamic of our identity drives so much about what we do in the first place. So traits commonly emphasized in this virtue-based approach to counseling ethics include things like prudence, practical wisdom, the ability to discern the right course of action in specific context, integrity, which is the consistency between one's values and one's actions, respectfulness, a genuine abiding of concern for the welfare of others, sometimes described as benevolence. And by doing this, it really articulates. So first we have to understand, who are you as a counselor? Well, that's very philosophical. That doesn't seem very ethical. Well, again, everything that we do is layered. So you may take a theories course this semester. You may take a marriage and family therapy course this semester. But the idea of that is these classes are not separated from one another. They overlap one another. They overlap one another. Who are you? Who has God called you to be as a clinician? Now, the reason this matters practically is that the principle alone can start to feel like a checklist. Okay, check, did that. Now, really, hear the heartbeat, feel the heartbeat, get into the heartbeat. A series of boxes to check. While virtual ethics remind us that a person doing the ethical reasoning matters just as much as the framework as using them. Okay, practical versus versus virtue ethics. The idea that two counselors could apply the same exact set of principles to the same situation and arrive at completely different orientations. Both defensible, conclusive, because they bring different characters, different clinical judgments, and different life expectancies to the interpretation. Which one are you? And if we don't know, then we need to draw a question mark around each one and ask God to continue to reveal to us. Which one do we typically orient from? Are we more action-oriented, more behavioralistic, expressive? Are we more interpersonal, self-assessed oriented? There we go. Couldn't get it out. The most contemporary thinking in our field doesn't ask you to choose one framework over the other. Instead, the two are seen as complementary. The principle ethics gives you a structured way to reason through specific dilemmas in the moment. Fantastic. Virtual ethics reminds you that good ethical practice over the course of an entire career. Complementary, and maybe even integrative, I'm not sure what word I was going for, in the moment. Okay. So let's bring it all together. As we're already at the 59-minute mark, let's close by connecting all this way back to where you are right now in the start of this course and how we take ethics into everything that we do. You're going to spend this semester and honestly the rest of your career developing what we call an ethical identity. And by doing that, I would actually ask for you to establish your professional identity by acknowledging who Christ has called you to be, sitting in this chair, and to the extent of speaking and orienting and impacting the people that are going to be sitting across from you. Plenty of counselors who get into serious ethical trouble could probably have recited the relevant sections of the code from memory. See, so knowing the code of ethics isn't necessary, but it is sufficient, because again, how many of them actually could recite the code by memory? See, knowledge alone doesn't prevent harm. What prevents harm is the ongoing habit of noticing when something feels ethically complicated. To be able to slow down and consult with a supervisor or colleague and reasoning carefully through the competing obligations at play, using the both structured lens of principles and the character-based lens of virtue, and to see what is going to be best for your expression of who you're called to be and how you impact that individual. So a few takeaways as you move forward within this course. First, get comfortable with ambiguity. Many of the case studies that you'll work through within this semester will not have a single clean, correct answer. That is not a flaw in the material. It's an accurate reflection of the work that you'll do. Get comfortable in your uncomfortableness. Second, build the habit of consultation early. One of the most consistent findings in research on ethical counselors is that they consult others when facing dilemmas rather than deciding it alone. Collaborate with your class. What would you do? And how do you consult ethically? Now, again, great thing is you are still under the coverage of this institution. But guess what? Even as we consult in the field, there is an ethical way of doing it and not. You see, this habit that we're, and the muscle that we're wanting to flex and get stronger, that starts now, not later once you're already licensed. Start now, start now, start now. Third, hold both mandatory and aspirational ethics in view. Know the floor. You must know it, but don't let the floor become your ceiling. In order to understand the floor, that helps us, from a mandatory standpoint, get to a place of aspirations. And fourth, remember that the code of ethics is a tool of thinking, not a substitute for thinking. Okay? The idea, there's going to be some nuance. Sometimes when you are stuck, and to the extent of it not telling you what to do, but it giving you some formations of knowing how to express it. It will not give answers to every question for you. It gives you the principles and structure. You still have to do the reasoning, the informed by specific and clients in the specific context, and for your own developing clinical of ethical judgment. So, as you can tell, this is the reason why this isn't just a side course. And it's not just a hoop to jump through before you get to the real clinical material. It is the real clinical material, because every skill you learn this semester, whether case conceptualization, intervention selection, cultural responsiveness, operates inside an ethical framework, whether you notice the frame or not. So in this, what I want you to do as you evaluate this week for week 1 until we move forward into our first time of getting to be in the same class for our next class together, I want you to have having read the assigned chapters, of course, and come ready to discuss them by asking, where do you think your own personal moral compass might occasionally be in tension with the professional ethical code that we will be studying? And in this, you may not have the answer definitively determined. That's okay. We've got all semester. You got the rest of your academic career to formulate that. But this is an opportunity for us to start pushing the boat out in the ocean. And this is not a hypothetical question. It is one that you'll face many times throughout your career. And today's lecture is meant to give you the vocabulary and the frameworks for you to start thinking through. So thank you so much, and we'll see you next time. Save this, reflect on it, and determine a working definition as Christ gives them to you, so that not only it is just a definition that you can rely on, but it becomes a foundation that you express from. Until next time, I'll see you then. Bye-bye.